Hi class, welcome to our module on psychology and physical health. I've divided this module into 3 videos. In this video, you'll be learning about stress, personality, and illness. You'll learn about type A personality and its link to hostility and heart disease. You'll learn about the relationship between emotional reactions and depression and heart disease. You'll also learn about the science behind the study of stress and its possible relationship to cancer, at least the disease progression. You'll also learn about various diseases and immune functioning and their relationship to stress. And you'll be able to evaluate by the end of this video the strength of the relationship between stress and illness. Before we get started, let's see what you think. So let's look at the first statement. Today, people's health is more likely to be compromised by contagious diseases rather than chronic illnesses. What do you think? Do you think this is definitely false, mostly true, or definitely true? If you selected definitely false, you're right. Today, the majority of people's health issues are related to chronic illnesses, and many of these chronic illnesses are within our control, at least to a large extent, and we'll be looking at this in this module. How about this? Anger and hostility towards others are major causes of heart disease and other cardiovascular problems. Do you think this is definitely false, mostly true, or definitely true? If you selected definitely true, you're right. We're going to be looking at anger and hostility and why they increase one's risk of developing cardiovascular problems. Let's look at another one. Health and well-being can be helped or harmed by people's lifestyles. What do you think? Is this definitely false, mostly true, or definitely true? It turns out that this is definitely true. We have a lot of control over our health and our well-being. Of course, when we think about health and well-being, we can't ignore our genetic predispositions and some of the environmental factors that we may be exposed to that are beyond our control. But a lot of our health is within our control, and we'll be exploring that in this module. Here's another one. People can experience an overdose using marijuana. We'll be looking at drug use and drug abuse later in our module. Do you think this is definitely false, mostly true, or definitely true? If you selected definitely true, you're right. I think that oftentimes when we think about overdose, we tend to think about the more dangerous drugs, those like opiates, for example, or some of the dangerous stimulants. But one can actually overdose on marijuana. Now, that does not mean that it's going to be fatal. It's very, very unlikely. But a person might experience things like extreme confusion, anxiety, paranoia, panic, fast heart rate, delusions or hallucinations, and they might even have some severe nausea and vomiting. And if there are any serious physical side effects from an overdose, it's very likely because there was something else that was in the marijuana that led to that. But there can be an overdose of marijuana. So again, we'll be looking at drug use later in our module. So let's begin our exploration of the relationship between stress, personality, and illness. To start us off, let's begin by looking at heart disease. This is an important topic because 1 in every 4 deaths is due to heart disease. The most common type of heart disease is coronary artery disease. And when we think about psychology and health, this is a great point of reflection because while there are certainly genetic predispositions that one may have to develop heart disease, there are a multitude of lifestyle factors that we have control over that can increase our chance of developing heart disease. In addition, stress, our emotional responses to stress, and even certain personality variables play a role in whether or not we develop heart disease. So first, what is coronary artery disease? Well, remember, this is the most common type of heart disease. Coronary artery disease develops when the major blood vessels that supply your heart become damaged or diseased. Cholesterol-containing deposits that are called plaques in your coronary arteries, and inflammation are usually to blame for coronary artery disease. So the coronary arteries supply blood, oxygen, and nutrients to your heart, and a buildup of plaque can narrow these arteries, and this then can decrease blood flow to your heart, and this is known as atherosclerosis. So eventually, the reduced blood flow may cause chest pain. You may have heard the phrase angina. So this reduced blood flow can cause that. It might also cause shortness of breath or other coronary artery disease signs and symptoms. And a complete blockage, and some of you may very unfortunately know someone or even have a family member who has had a complete blockage and has had a heart attack, because a complete blockage can cause a heart attack. Fortunately, if a heart attack is addressed early, the person can get treatment. They can have surgery that can help to reduce that blockage. And they can also recover very well. Of course, they're going to have to make many different lifestyle changes to reduce the chance that they're going to have a heart attack in the future. For many of you who are in this course, you're probably pretty young. Some of you may be only a couple of years or even a year out of high school, and you may think to yourself that this is something that you don't need to think about right now. But it actually is something that you need to be thinking about now, and this is because coronary artery disease develops over decades, and you might not notice a problem until you have a significant blockage or a heart attack. The choices that you make today have a significant effect on your health later on. We can think of it as a very important investment. We can pay now or we can pay later. So you can take steps to prevent and treat coronary artery disease. And this is where a healthy lifestyle can make a very significant impact. And this is where psychology comes in. How can we, within the field of psychology, have a positive effect on the behavioral choices of people who may be prone to developing heart disease, or even just on the population in general? How can we have an effect on people who may have certain personality traits that make them vulnerable to developing heart disease? Heart disease is not something that just affects the individual. We know that when someone has heart disease, and especially if they end up having a heart attack, that this can have a significant effect on the individual's family. It can lead to, of course, a person not surviving, but even if they do survive, the person may have difficulty doing what they used to do, especially if it's taking time for them to recover, which for some people can take quite a while for them to recover from their heart attack. And this can have an effect on the family. It can have an effect on the well-being of the family and the financial stability of the family. If we think about our communities, think about this. If we could reduce the rate of heart attacks, remember, if we think about just heart disease is the cause of death for 1 in 4 people. So imagine if we could reduce that number. Think about what that would mean for our community. Think about what's lost when people are no longer able to work, but perhaps much worse, and definitely much worse, don't survive. And when they don't survive, what have we lost as a community? What have we lost in terms of what that person could have contributed to the community to make it a better place for us to live in currently and for future generations? So it's in all of our interest to think about what can be done to reduce the risks of developing heart disease. This is an image that's taken from your textbook, and this shows you atherosclerosis. And this again is a narrowing of the coronary arteries and is the principal cause of coronary disease. For A, we see a normal artery, and then B, we have some fatty deposits, cholesterol, and cellular debris that are on the walls of the artery. And this then can narrow the path for blood flow. And then C, we see advanced atherosclerosis. In this situation, a blood clot might suddenly block the flow of blood through the artery. There are factors that are within our control and outside of our control. We can't control how old we are, and getting older increases one's risk for having damaged or narrowed arteries. But remember, the better choices that you make early on in your life, the better off you are later on, because the effects of your choices that you make when you're in your teens, your late teens, your 20s and 30s will show up when you move into your 40s and 50s. Sex is another risk factor. Men are generally at a greater risk of coronary artery disease, but I will point out that the risk for women increases after menopause. And the signs of a heart attack for women are also different. And so it is important, if you are a person who has family of that age, or maybe you are of that age, and or you maybe work with people who are that age. Maybe you work in a facility where you're helping people who are of that age. It's very important to know the signs of a heart attack in women versus men, because they are not the same. And sometimes women may dismiss their symptoms thinking, hey, it's not a heart attack. I'm not having the classic signs of a lot of chest pain. So women may have some very different symptoms. I'd encourage you to look into that. Also, family history. We cannot control our family history. And we know that if you have a family member who's had heart disease, this is associated with a higher risk of coronary artery disease for you. And so this is especially true if a close relative developed heart disease at an early age. And your risk is highest if your father or your brother was diagnosed with heart disease before age 55, or if your mother or sister developed it before age 65. So there's some very specific risk factors that are very important when we think about the people who are most likely or who are more likely to develop heart disease. And these are things that are out of our control. I think another one that's important to note is cholesterol. While cholesterol is something that we do have a significant degree of control over, there are also factors related to cholesterol that are outside of our control. You may eat a healthy diet, you may get good exercise, you might keep the saturated fats down, but you might still have high cholesterol because of your genetic predispositions. And it's going to be important for anyone who has that family history to be regularly checked by their doctor to make sure that they're not heading into that risk category. Another factor, and this is one that is, of course, within our control. We know that when people smoke, they have a significantly increased risk of heart disease. And so health psychologists focus on, for example, strategies for helping people to quit smoking, but also when we think about communities or we think about areas where we may see higher rates of smoking, we can think about government programs employing health psychologists to come up with strategies to reduce smoking behavior. And there are many different, very effective programs that have been in place that have dramatically reduced smoking. If we look at smoking rates today versus what we saw 20, 30 years ago, they have significantly declined. And we'll be looking at that later on in this module. And then even breathing in secondhand smoke can increase a person's risk of coronary artery disease. Another is high blood pressure. This is something that is to a degree within your control and then also outside of your control. High blood pressure, this is something that if you have a very sedentary lifestyle, if you are eating unhealthy foods, if you are overweight or obese, if you have a diet that's high in salt, those are things that are within your control. And so these are factors that health psychologists will be interested in focusing on. And again, when we think about the goals of health psychologists, and there are many health psychologists who work for communities, state governments, and the federal government, and also at universities and colleges to help to conduct research in areas that are related to the development of heart disease, and especially because we know that that is such a significant cause of death, and then to identify specific strategies to reduce those behaviors or curb those behaviors. So we also know that high blood pressure, of course, can be something that you have a genetic predisposition to having. And then sometimes people may have underlying health conditions that predispose them to high blood pressure, and those may be outside of their control. So for example, someone may have had problems with their kidneys and perhaps I had a family member who had one of their kidneys removed and then a quarter of another one of their kidneys removed because they had kidney cancer. That was outside of their control that they developed that. Perhaps there were some lifestyle choices that may have contributed to that, but it seemed to be very largely outside of their control. And because of their kidney cancer and having one and a quarter of their kidneys removed, they now have very high blood pressure, or they develop that and they have to stay on blood pressure medication. So there are things outside of our control, but we want to think about in health psychology, what can we do that's within our control? And within that field of health psychology, so if you're a person who is very interested in health sciences and you're interested in psychology, this is a great field to explore, where you could have a very positive effect on people's lives and be really doing research and also practice, where you're actually employing programs or developing programs that can reduce unhealthy behaviors. So again, high blood pressure is another factor, and then high blood cholesterol levels, that's another risk factor. And then also another risk factor is diabetes. And we know that some people are genetically predisposed to developing type 2 diabetes, but to a large degree, type 2 diabetes is related to some of the choices that we may make. Think about the diet that leads to type 2 diabetes, and of course, some people may eat an unhealthy diet, never develop diabetes, but then others do. And that says a lot about their genetic predispositions. In our country, we have a diet that is very high in saturated fats. It's high in sugars. If you look at most products, there is some amount of sugar in them, especially those that are very refined and processed. And so when people are consuming a lot of that, when they're not getting physical activity, and especially when they are overweight and obese, then this creates a risk for developing diabetes. And then diabetes then becomes the risk for developing heart disease. So as I've talked about each of these, think about the things that health psychologists might be interested in focusing on that could address some of the underlying causes of heart disease. Think about the overall cost of heart disease to us as a society, the economic cost, the loss of productivity. Think about the overall emotional cost. We know that when people develop heart disease and have heart attacks, that they are more prone to developing depression. We'll be talking about the depression and heart disease link here in just a few moments, but there is a significant cost for heart disease. And then another one, of course, is being overweight or obese and then not having very much physical activity and an unhealthy diet. One that we'll be looking at here in just a few moments is high stress. And we're going to look at why is it that people who are under high levels of stress, or in particular, why is it that why is it that some people when under stress seem to more negatively respond to stress? Their body seems to more negatively respond than others. What's going on in their body that is leading to that particular response that increases their chance of developing atherosclerosis? And I want to point out that these are just a few risk factors. Researchers are looking at lots of additional risk factors that are of great interest. I think one that we see that's pretty prominent today, especially as we have greater access to sleep studies, but also where we're seeing more people who are overweight and obese, is sleep apnea. Now, I want to preface this by saying that not all people who develop sleep apnea are overweight or obese. There are other factors that can contribute to that, but that's a significant risk factor. And sleep apnea, as many of you know, is where you are sleeping and you repeatedly stop and start breathing. And these sudden drops in blood oxygen levels that occur during sleep apnea, what they do is they increase blood pressure and they strain our cardiovascular system. And this may possibly lead to coronary artery disease. So the person with sleep apnea may go to the doctor, their blood pressure looks great, everything seems okay, but through the night they're having hidden high blood pressure. So it's very important if someone has some symptoms of sleep apnea, which is excessive sleepiness during the day, having reports from their sleep partner or roommate that they snore a lot. These are two big factors that may be indicators that the person has sleep apnea. So as I mentioned, I think often when we think about diseases, we think about factors like genetics, diet, exercise, and other lifestyle factors. But there are many other factors that can contribute to disease that are related to how we think and how we mentally feel. One of these factors is what's called type A personality. Now, before I get into the effects of this personality type on your health, let's first think about what type A personality looks like. I'm going to place a link to a type A personality test on the course website in this module that you'll be able to find under the supplemental resources link. I'd encourage you to take it and for you to give the test to anyone you think might have this personality type. Taking assessments like this is a good way to think about the application of what you're learning to your own life. So we all know someone who is overly competitive, maybe this is you, maybe impatient, but have you ever considered what else goes alongside those traits? So there actually are some factors or traits that go alongside being competitive and impatient. And for some of you, you may have seen these in yourselves. So have you ever wondered if you do have those traits, how others may best be able to be around you, or maybe you do feel so impatient or time pressured that you don't feel like you have the time to think about this. Or perhaps you know people who are very competitive and impatient, and you really don't know how it is best to be around someone with those traits. Maybe they make you feel a little bit nervous because of their sense of urgency. So if you've been around anyone with a few of these traits that you see here on the screen, what you've been around is very likely a person who has type A personality traits. Now I want you to think about type A and B personality as falling along a continuum. So what this means is that it's not as though you are type A or you are type B. You can fall somewhere in the middle. For some of you, you may be very type A, and for others, you may be very type B. As you look at this screen here, you'll note two adjectives, anger and hostility. Not all people who are type A have anger and hostility. Some people may be very low in these traits, so they might not be very easily angered or hostile. So I want to point out that type A personality, although we may have historically thought of it or heard about it in negative terms, for some of you, you may have, because of anger and hostility, it's not always tied to anger and hostility. Actually, type A personality, just like type B, can be associated with some very redeeming qualities. And I want to point that out first. I think it's important for us to think about the redeeming qualities of a type A personality type. So people with a type A personality tend to be very, very motivated and very productive. They tend to have a lot of energy, and they also tend to be competitive. And while some may think of this in some negative sense, and it can be, if it can sabotage relationships, it can actually be a very good thing. So being type A is not a bad thing. Type A is it's just an overarching phrase that we can use to describe a series of traits that, when we include anger and hostility, increases one's risk for developing coronary heart disease. And we're going to look at why that is. Now, on the other end of the spectrum, we have people who are type B. And people who are type B tend to be relaxed, more, pretty patient, easygoing. They don't feel this sense of time urgency. So when you're in a conversation with a type B person, they're not trying to get you to get to the point quickly. They're much more likely to feel like they have the time to listen to what you have to say, and they want to hear what you have to say. They don't feel that sense of pressure that perhaps the type A person might have. I think it's interesting to point out that we often think of type A's because perhaps of their high degree of competitiveness, and also because they often can be very productive. We might think of them as being more likely to be, for example, CEOs of corporations or leaders in big companies. But actually, the research suggests that more people who are leaders in corporations tend to be type B, and more leaders in general tend to be type B. And if we think about I'm talking about like higher level leaders. If we think about perhaps someone you may have worked under directly that maybe wasn't a very high level leader, that person may have been type A. But do you think that that person would be someone who would have the patience to listen to others and to really think about the problems that are going on within the company or within wherever it is that you work, which are very important behaviors when we think about leadership. So for people who are great leaders, they take the time to listen. They take the time to, they want to spend time with people to get to know them. And they are, because they are more relaxed and easygoing, they are more likely then to be creative. And when we think about productivity, although type A people tend to be very productive, sometimes it's more of a numbers game than it is of a quality game. And it's not to suggest that type A people don't have high quality output, but sometimes there may be this great internal pressure that they feel to produce, that they may, if they have a lot of internal pressure or external pressure as well, what they output is may not be as great as it would be for a type B person. And output meaning the overall quality of the output, because they feel that sense of pressure, which we know can have a negative effect on creativity. So take a moment to reflect. Do you know anyone, including yourself, who seems to fit the profile of a type A personality? And if you do, if it's you or if it's someone you know, can you identify examples of those three elements that were on the last slide in this individual? What was it that led you to conclude that that person or you have that type A personality? For many years, as a matter of fact, it's been over 30 years, researchers have pursued the idea that type A personalities are heart attack prone, especially when they're compared to their more laid back type Bs. And so the question becomes, what is it about type A personalities that make people heart attack prone? Is it because of just being competitive? Or is it because of having a sense of time urgency? Or is it the anger hostility component? And so this notion that there is a link between type A personality and heart disease actually became pretty common language and led to some mistaken notions about type A personality, which I think contributed to some of the negative views that some people, certainly not all, but that some people may have about type A personality. And they may see it as an automatic red flag for heart issues. But actually, it's not all type A traits that are leading to that increased risk. It is the anger hostility component. So individuals, it shows in research that those who have above average hostility scores, they were twice as likely to have atherosclerosis than those with below average hostility scores. And remember, that hostility is a component that is sometimes seen in type A personality types. So what do we mean by hostility? When we think about any type of research, we have to clearly define the variable that's under study. And the way that researchers have considered hostility is they've considered it as including anger, having a chronically cynical or mistrustful outlook, aggression, an impulse to oppose others, and even sometimes, when very upset, a desire to hurt others. Now, that doesn't have to be physical, but it could be just with words. And hostility could be expressed outwardly with verbal insults, or for some people, even being physically aggressive. And sometimes this hostility can be held in as angry or cynical or suspicious thoughts and feelings. So there seems to be, like I said, this clear connection between people who are hostile and heart disease risk. But it does seem that in particular, it's people who are outwardly hostile that have the highest risk. And if people have hostile feelings and thoughts and they keep them inside, the relationship is a little bit weaker. So it seems that that outward hostility seems to increase that chance of heart disease more than that inward or self-directed hostility. But if you're a person who has hostility or you know someone who does and you don't outwardly express it, you are definitely not in the clear. You are still at a greatly increased risk, or that person is, of having atherosclerosis and that blockage of coronary arteries. And then you're more likely to have a heart attack. So just as an example, as I was looking at some of the literature on this, there was a study of 255 physicians who were given a series of psychological tests when they were students in medical school. And then they were followed for the next 25 years. This is an example of a longitudinal study. And those who had scored higher on the hostility scale had 4 times the incidence of heart disease. Now, as you're hearing this, you may think to yourself, well, yeah, because people who are hostile are probably more likely to smoke and drink or engage in other unhealthy behaviors. But even when the researchers control for these factors, that is, they use statistical techniques to make sure the factors weren't tilting the data, hostility shows up still as a warning sign for future heart trouble. Here's a bar graph from your textbook that illustrates anger and coronary risk. And so the researchers worked with a large sample of healthy men and women who were followed for a median of 4.5 years. And the researchers found an association between anger and the likelihood of having a coronary event. And among participants who showed normal blood pressure at the beginning of the study, a moderate level of anger was associated with a 36% increase in heart attacks, and a high level of anger nearly tripled the participants' risk for coronary disease. For many of you, as you think about type A and B personalities, and there are other major personality types that we'll look at later, but what I want to point out at this point is that for some of you, as you look at these two personalities, you may think to yourself, hey, I'm leaning more towards type A, but I don't tend to get angry that often. Or maybe you lean more towards type B and you don't tend to get angry that often. And everyone gets angry from time to time. We get upset. We feel frustrated. It's a normal human response to being treated unfair or to other injustices. And it's very common to experience this in reaction to being frustrated or to feeling like we're being criticized, even if this anger is not justified. But of course, normal anger is one thing. And feeling angry and then being able to direct it in a healthy way or express it in a healthy way, that's one thing. But excessive hostility is quite another. And some people get angry without provocation, and others react excessively to minor adversity. And then others may experience inappropriately intense or prolonged anger to things that legitimately would make a person angry, but there's a greater intensity than there would be in most people, and that anger is prolonged. And the problem is that, of course, there are a multitude of consequences for this, but when we think about the heart, a angry or hostile heart is one that's vulnerable. And researchers have shown that anger can have both short and long-term consequences. So in a longitudinal study, researchers looked at men who were over the age or had an average age of 62, and there were over 1,000 men in this study. And each participant took a psychological test. And what this test measured was it measured anger. And so it had the participants, what the researchers did is they asked the participants to rate their anger level. And the men returned later for detailed medical exams. And they did this every 3 to 5 years. So they measured hostility and then they did detailed medical exams. And when they did this, they were checked for heart disease and cardiac risks like smoking and hypertension, high blood pressure, high cholesterol, and diabetes. And none of the men had coronary artery disease at the start of the study. But out of these participants, and there were over 1,000, there were well over 1,000, I think it was around 1,300, 110 of these participants developed coronary artery disease within 7 years. So all in all, what the researchers found was that the men who were the angriest, they were 3 times more likely to develop heart disease than the most, the men who were the most calm, who were the least angry. And the link between anger and heart disease was not explained by differences in this study in blood pressure, smoking, or other heart risk factors. Hostility was causing the heart problems in its own right. And so your question probably at this point is, how does hostility harm the heart? And so here's what it does. Like other forms of stress, anger triggers a surge of stress hormones, including adrenaline. And adrenaline is a stress hormone that increases blood pressure and pulse rate. And what it's doing is it's increasing the heart's workload. And when it's doing this, it's increasing its need for oxygen. And adrenaline can also provoke abnormal heart rhithms. And this can actually lead to some very serious arrhythmias, ventricular arrhythmias. Some of you, may know people who've had this before. And I want to point out too that this stress hormone, or this response that our body has, which actually is very adaptive, it's normal for us to have this response in times of actual threat and danger. But if we are chronically experiencing a stress response because we have this heightened feeling of being threatened and we're angry, then this is going to have very damaging effects on our heart because of, again, that adrenaline. So adrenaline also can activate platelets, and platelets are small blood cells that trigger blood clots. And then these can then block arteries that are already perhaps narrowed by cholesterol plaques or atherosclerosis. So that's another problem when you have hostility, is you have this increased um, activation of platelets, again, triggering blood clots potentially that can block arteries that already are narrowed. And remember, if you're a person who's hostile, you possibly may also be very cynical, and this then can contribute to some of the behaviors that you might engage in. You might not be as likely to take care of your health. You might not be as likely to, for example, exercise or eat well because you think, you're kind of like, well, what's the point? Why am I even going to be doing that? So there's this increased cynicism. So you might already be prone to having blocked arteries because of some of the behaviors associated with hostility. And then I want to point out too that when you're very angry, this can actually cause a spasm in the coronary artery, which can then result in even more narrowing of a partially blocked blood vessel. So those are the physical effects of hostility. So it's so important for us, if we have any of those, if we see any of that in ourselves, or if you're working with clients, if as you move into your profession later on, it's so important when we think about hostility to not only think about its negative effect on relationships and how we feel mentally, but this can be very significantly detrimental to our health and well-being. There are lots of things we can do to reduce hostility. I'll talk about these later on, but one that I think can be helpful is to start journaling. And I know that oftentimes people who are type A are less likely to feel like they have the time to write things down in a journal, but even just keeping a little notepad with you or putting something on your phone, anytime you feel easily angered, you feel like someone has really made you mad or something's made you mad, just jotting it down, what happened, what you were thinking, and what you were feeling. And then at the end of the day, and do this for many days, look at your journal. And I think what you'll start to notice is a pattern of irrational thinking and responses. And sometimes recognizing that can be very helpful so that we can begin to challenge those thoughts that might lead to hostility. In addition to those physical factors or physical effects of hostility, there are many additional explanations that link anger and hostility to heart. I'm sure that as we've looked at hostility and its relationship to coronary artery disease, you've had many thoughts about what might be contributing to that relationship. We've already looked at the physiological factors that contribute to that relationship. So As a person who is more prone to be hostile has greater physiological reactivity in response to stress, this then can cause wear and tear in their cardiovascular system. And then what we also see in terms of explaining that relationship is there's an increased chance of being exposed to self-imposed stress because hostility and anger lead to interpersonal difficulties. Also, hostility may undermine social support from others that would have otherwise buffered the effects of stress. So think about how important social support is when we experience stress. And if you're hostile, you're cynical, you're less likely to have that social support. So that's another variable that can help to explain that relationship. And then finally, there's cynicism. And like I mentioned just a few moments ago, this often comes with hostility, and it might lead to poor health habits like a lack of exercise, excessive consumption of fast foods, or the denial of symptoms. And you can find this image in your textbook. I think it's a great image that can help you to think about the relationship between hostility and anger and coronary heart disease and the multitude of variables that might explain that relationship. And then if we take this a step further, we can think about how health psychologists might approach research if they wanted to further understand this relationship. They could approach research from the standpoint of trying to understand the relationship, and then they could also approach research by creating interventions to help to moderate the effects of this relationship. Overall, our emotional reactions can contribute to heart disease. And transient mental stress and its resulting strong emotions can have a significant effect on the heart by taxing the heart. Even brief periods of stress can trigger acute cardiac symptoms like angina or chest pain. And researchers have found that when interviewed after surviving a heart attack, many patients say that an episode of anger triggered the symptoms. And something called rumination has also been implicated. Some of you may know what rumination is, but for those of you who don't, rumination is the focused attention on the symptoms of one's distress and on its possible causes and consequences, as opposed to focusing on solutions. And so as we've looked at, clearly there is a relationship between stress and heart disease, and research suggests that there's a relationship between depression and heart disease. And it's thought that an important factor that's linking heart disease and depression is stress. So stress is the key to understanding the association between depression and heart disease. Stress can, of course, lead to depression, and depression in turn can become stressful. And the body's immune system fights stress just as it would fight a disease or an infection. And in response to stress, the immune system produces proteins that we've talked about, like cytokines, also produces stress hormones that we've looked at. And these proteins, these cytokines that you probably have heard of because of COVID, you've heard of the cytokine or cytokine storm, that this is an inflammatory response that our body has. And so initially, this protects us against stress. But over time, when you have chronic stress, you have a potential for chronic inflammatory responses in your body. And this then can lead to things like hardening of the arteries and cardiovascular disease, just to name a few. We're going to look at some additional diseases and health issues that are associated with stress here in just a moment. I'd like you to take a moment to reflect. Some people report that they seem more likely to contract a viral infection right after they have had a particularly hectic or stressful period, like during a break just after a very busy semester. I know for myself, when I was in college, I felt like, and I actually am pretty sure that this happened, at the end of every fall semester, right after finals, I would get sick. And it seemed like it happened like clockwork in my undergrad and in graduate school. And I know, of course, it's during a time when there's an increase in flu viruses around. There's an increased likelihood that I'm going to be getting sick because of more of these viruses in our environment. But it didn't seem to happen much at other times. For example, it wasn't happening much in the fall for me. but it happened when I felt like I was under the most stress. And I wonder, has that happened to you? Have you found yourself getting sick at certain times when you've been at that peak level of stress? And how do you think that this experience that you may have had, or maybe it's someone you know, relates to the apparent link between stress and immune functioning? So think about what you've read in your textbook. If you haven't read your book yet, make sure that you do read the chapter. I'm sure you are each doing this. I can tell that you all are from your discussions and how well you all are doing. Many of you are doing on those discussions, and I'm feeling very confident that you're doing that. But as you look in your textbook, what you'll find is that there's a really nice description for you about the relationship between stress and the immune system. So I want to summarize that for you. And I want you to know that your immune system knows when you're stressed. And it knows when you're stressed about all the different things in your life that may be stressful, whether it's your work, school, family, money, current events like coronavirus, watching the news and endlessly seeing stories about coronavirus that can cause a lot of stress. And the body's natural defender is sensitive. Our immune system is sensitive to psychological stress, especially if it's chronic. And stress can reduce the number of what are called lymphocytes, or also our natural killer cells in the body. And these are needed to fight viruses. And stress can cause our immune system to produce an inflammatory response. And this is temporarily beneficial for fighting germs. But if it's persistent and widespread, it can contribute to chronic diseases. It, of course, can contribute to heart disease, but it can contribute to lots of other health issues. So chronic high levels of stress can produce higher than normal levels of cortisol. And I've mentioned cortisol in this module already and in previous modules. And this can hamper our ability, our body's ability to have that anti-inflammatory response, and it can cause then continual infections. Probably many of you have heard perhaps people suggest that there may be a relationship between stress and cancer. And what I wanted to share with you is what the research has to say about this. Well, first of all, what is cancer? There are lots of different types of cancers. Overall, it is a malignant cell growth that can occur in many different organ systems in the body. And stress is related to, but not necessarily causally linked to, the onset of cancer. But stress can affect the course of the disease. So it can affect how well a person does as they go through treatment. And personality factors can affect how well a person gets through treatment as well. Think about factors like hostility and cynicism and how those variables, those personality traits, might negatively lead to or have a negative effect on the course of the disease. There was a really interesting person. His name was Lawrence Lashon. And I'd encourage you, if you're interested in how early childhood experiences may later have an effect on this, this is certainly, or may later have an effect on us. This person, Lawrence Lashon, was he was probably one of the pioneers in this area of study, where he was looking at what is it in people's lives, in their earlier lives, that may contribute to specifically cancer. And he was a psychotherapist, and he studied the lives of more than 500 cancer patients, many of whom he worked with in psychotherapy. And he found that there was an emotional life history pattern in many of the cancer patients, and that it actually, in their specific number, he found that there was a distinct emotional life history pattern in 76% of the cancer patients, and that that same pattern only showed up in 10% of the control group that didn't have cancer. And so what was this emotional life history? Well, it turned out that this history included having an experience when a person was a child, of having extreme difficulty in establishing warm, satisfying relationships. usually in his experience because of the death of a parent, divorce, chronic conflict, maybe separation from one or both parents, and the child developed a deep sense of isolation and loneliness, and had really a hopeless, what he said was a hopeless view of ever gaining lasting, fulfilling relationships. And the child then tried to please others in order to win affection. And that in adulthood, the person found strength and meaning in a relationship or career and put a lot of energy into this very important source of support for them. And then when that source was removed, like through death, divorce, or problems in the relationship, or retirement, if it was work, and then what happened was that that childhood wound was reopened. And then that person experienced a sense of loss, despair, and hopelessness and helplessness. And that he thought, and he in his experience, he said that feelings like really negative feelings like anger and hurt and disappointment were often bottled up, and that maybe people would view the person who'd gone through such difficulty as though they had they were too good to be true. Maybe they see, how could they be, everything seemed so good for them when they had this difficult childhood, and then they'd experience later this loss, whether it be in a relationship or with their job. And that and what he said was that this too good to be true appearance that he called it was really almost like a superficial quality that was more a reflection of a deeper inability to express hostility, and that the person may have been overcompensating then for feelings of unworthiness. And so it's really important to point out here that this was one person who was doing this. This is just one psychotherapist who was looking at his case histories. This is not, this is certainly not supported as like truths in the research where we would say, if you have this happen in your childhood, you will develop cancer. But it really sparked interest in what is it that maybe is going on in our emotional life that may lead to increased likelihood of developing cancer. And so his research identified emotions as a particular factor that could contribute to cancer, but there's still so much that is unknown that we can't say with certainty that it's the emotions that are causing this. That was his analysis. It may be other variables that are associated with that person's experiences of having had a very difficult childhood that are then related to lifestyle that increase their risk of developing cancer. So that sounds so very negative as we think about the early experiences that are really completely outside of our control, that based on what he's saying may have a negative effect on us in our health. And we know when we look at adverse childhood experiences, ACEs, that many of you are familiar with, that those early experiences that we have that are traumatic increase our risk for many different health outcomes, and both physical and mental health outcomes. But I want to be positive for a moment and point out too that there is a positive role for emotions in cancer. So just as an attitude of having hopelessness and helplessness might hurt a person's chances of having good health or recovering, perhaps because they're not complying with getting the treatment they need, or because of how their body's responding in response to that, having an attitude of determination and hope and fighting back can lead to a positive outcome. So it's not to suggest that it always will lead to a positive outcome. And I think we have to be cautious when we say this, because then people may begin to engage in self-blame and thinking, I didn't think positively enough. So we have to take this with a grain of salt, and we need to be very cautious when we think about our own role in affecting health outcomes. But bottling up emotions, we know, can have an effect on our overall health. And so when we think about cancer and we think about recovery from cancer, there are Even though there are many physicians who are skeptical of the role of stress in the onset of cancer, physicians will often speak of the will to live as an important element of treatment. And adding counseling and stress reduction techniques to traditional medical care is becoming more common. And this brings on again the role of the health psychologist. Stress can lead to other health issues and diseases, and it also can lead to a variety of physical symptoms. We know that it's characterized as one of the primary causes of headaches, and among infectious diseases, it's been implicated in the development of the common cold. Of course, first a person needs to be exposed to the cold virus, but when you're under stress, you're more vulnerable, and we've talked about why that is. And typically, if you were to look at a study where researchers wanted to investigate the relationship between stress and getting a cold virus, it would typically involve intentionally inoculating healthy volunteers with cold viruses and then keeping them under quarantine, maybe like in a separate hotel or separate hotel rooms, and then observing who does or who does not come down with a cold. And so when researchers have done studies like this, they've often found that people who report higher levels of stress are more likely to actually become ill, to have the symptoms of the common cold. And in one study, they found that people who are social and who are agreeable they're less likely to get the cold or the symptoms of the cold after being exposed to the virus. Here's a diagram from your textbook that illustrates for you stress and health problems. And here we see a significant number of health problems that may be affected by stress. And the evidence seems to be pretty fragmentary in many instances. So here, some of the health problems are much more well supported in the literature than others. It is alarming, I think, to see the number and the diversity of problems that are on this list. So I'd like to take a moment just to go back over stress and immune function, just to be sure that you understand that relationship. When we experience stress, as you've learned, there's a release of stress hormones, including cortisol. And in short spurts, like in the case of acute stressors, remember acute stressors are those short-term stressors. Cortisol then can boost your immunity by limiting inflammation. But over time, when we experience chronic stressors, when those acute stressors turn into long-term stressors, your body can get used to having too much cortisol in your blood, and this then opens the door for more inflammation. And then in addition, stress decreases our white blood cells, the lymphocytes that help fight off infection. And the lower your white blood cell level, the more at risk you are for viruses, including the common cold. And as we've talked about, as I mentioned, when we think about the relationship between depression and health, high stress levels can cause depression and anxiety, again, leading to higher levels of inflammation. In the long term, sustained high levels of inflammation point to an overworked, overtired immune system that is then unable to properly protect you. So let's take a moment to test yourself. So experiencing depression blank a person's likelihood of developing heart disease actually decreases, nearly doubles, does not impact, negligibly increases. Now, I did not mention nearly doubles or decreases. I didn't give you a percentage. I did say it increases. You should be looking in your textbook. Your textbook points out that experiencing depression actually, you should know, it nearly doubles a person's likelihood of developing heart disease. Let's look at the next one. All right, here's another question. Research by Cohen. Now, you might not remember this name, Cohen, and when you take a test in this course, I'm not going to be asking you obscure author names, but you should know overall about what the research has to say about some of these important themes and concepts. And so just a few moments ago, we looked at the relationship between getting a cold and certain personality variables. And As we looked at this, I described for you that people who were in a classic type of study where we would want to see if they were exposed to the cold virus, would they develop symptoms? And they found that people who were exposed to the cold virus, they were put into these separate hotel rooms. They then found that some people developed the cold, others didn't, and they found that there was a large number of people who did who had experienced higher levels of stress. But they also have found in one study that people who were were at a lower risk of contracting a cold virus or a cold after virus exposure. So which was it? If you chose agreeable, you're right. So being agreeable seemed to decrease the risk of developing the cold. And so too is being more social. How about this one? Work on stress and the human immune system have uncovered which of the following trends? Stress is related to decreased levels of immune activity. It's related to increased levels of immune activity. It's unrelated to immune activity, or acute stress affects immune activity, but chronic stress does not. So which of these is the right answer? Which one is true? If you selected stress is related to decreased levels of immune activity, you are correct. So we know when we look at this last option, acute stress, it does affect immune activity, of course, but chronic stress does too. So that would not be the correct answer. And we know that it does cause a decrease in our immune activity, especially over the long term. We talked about white blood cells and how we can have a decrease in those white blood cells, which can make it then more difficult for our body to fight off illnesses and diseases. And we know, of course, clearly that stress is related to immune activity in humans. Here's another one. Will is driven to make partner at his law firm, and in the morning he often loses his temper when he has to wait in line for his morning espresso. He'll often insult the baristas for no reason other than his impatience and need to get working in his office before the rest of the firm arrives. Probably some of you have been around people who are like this. What type of personality is Will demonstrating? So you should probably very easily be able to identify this. And if you selected type A, you're right. Now remember, a type A personality is not always characterized by features of hostility. The person may not have hostility and may just be competitive and have more of a sense of urgency and be very conscientious about time. But that hostility factor is what increases that person's risk of developing heart disease. Here's another. Which of the following is not an element of type A? Impatience and time urgency, strong competitiveness, steady working, or anger and hostility? If you selected steady working, you're correct. This reminds me of that story about the tortoise and the hare who were in the race, and you would expect that the hare is going to win, the rabbit's going to win because he's so fast, but he doesn't, and we know that the tortoise wins, and he is slow and steady, and I always think of that phrase, slow and steady wins the race. So impatience and time urgency, strong competitiveness, these are elements of type A, and we often will see anger and hostility, though not always. What about this one? Which of the following people is most likely to have reduced immune system functioning? Rosa, who cares for her autistic son, Clint, whose wife passed away, April, whose truck was repossessed by the bank, or Mike, who lost his home in a hurricane. This is a little bit more of a difficult question, because what you're being asked to do is you're asked to think about the different types of stressors and how these stressors might affect the person. So Rosa, she's caring for an autistic son. This is chronic, right? It's chronic. There's no end in sight. This is not going to likely stop. Whereas Clint, his wife passed away, that's going to go on for some time, that he's going to experience the depression and the grief from that, but it will gradually subside. April, whose truck was repossessed by the bank, she's not going to, for years, probably be experiencing the stressors from this. It's more of an acute stressor. And then Mike, who lost his home. It is an acute stressor. Both of these, April and Mike, are probably acute that could turn into chronic, but the one that's the most chronic and the most present in the person's life and the most long-term is going to be Rosa, who cares for her autistic son. And so we're probably going to find that Rosa is more vulnerable to getting sick during cold and flu season. We're probably going to find that she might even, because of all the stress, she might be more prone to having an overactive immune response. So she might even have some inflammatory issues, some health issues that are related to that as well that you've read about in your textbook. Let's try another one. Instead of losing her temper on any of her colleagues, Meredith tends to bottle up her emotions and not let them out for anyone at work to see. But of course, it's not like those emotions just go away. She's not in this question or statement. We're not hearing about Meredith finding healthy ways of expressing those emotions. She is bottling them up. And so what is she more likely to do then? Is she more likely to harbor negative feelings, ruminate, become depressed? Well, which do you think it is? If you selected all of these are true, you're right. And please remember what ruminate means. When we ruminate, we're not thinking about solutions to the problem. We're just thinking about the problem and all of the negative things that could be associated with that problem. We know that harboring negative feelings, ruminating, and becoming depressed are all potential risk factors for the development of various health issues. What have you learned up to this point? In this video, you learned that type A personality has a link to heart disease, and that's because of hostility. So you learned about type A personality, the characteristics. You learned about why hostility may increase one's risk of heart disease. You also learned about evidence that relates emotional reactions and depression to heart disease. You learned about evidence linking stress to cancer. You learned that, for example, it may not be that stress is causing cancer, but instead that stress affects the progression of the disease. You also learned that stress is related to the development of various diseases and can affect immune functioning, and you learned about why. You learned the underlying reasons for this connection, and then you learned about the relationship between stress and illness. What will you be learning next? In our next video, you're going to be learning about some of the reasons that people develop health impairing habits. You'll learn about the health effects of smoking and the challenges of quitting smoking. You'll also learn about alcohol use and the health risks and social costs of drinking. You'll learn about the health risks and some of the determinants of obesity and the key elements of weight loss efforts. And you'll also be learning about HIV and AIDS. I look forward to seeing each of you online. And as always, please don't hesitate to let me know what questions you have.